Centella asiatica, commonly known as Gotu Kola, Kodavan, Indian pennywort and Asiatic pennywort, is a herbaceous, perennial plant. Historically, Gotu Kola has also been used to treat syphilis, hepatitis, stomach ulcers, mental fatigue, epilepsy, diarrhea, fever, and asthma. Today, in the US and Europe, Gotu Kola is most often used to treat varicose veins and chronic venous insufficiency, a condition where blood pools in the legs. In traditional medicine, Centella asiatica or Gotu Kola has been used to treat various disorders and minor wounds, although clinical efficacy and safety have not been scientifically confirmed. Contact dermatitis and skin irritation can result from topical application. Drowsiness may occur after consuming it. The herb may have adverse effects on liver function when used over many months. A few studies have found that Gotu Kola creams or ointments might prevent scarring and help with wound healing and psoriasis. These creams may help reduce stretch marks during pregnancy. Again, more research is needed to know for sure. Gotu Kola can enhance your memory and overall cognitive function, which means it may have potential in treating Alzheimer's disease. A 2016 study compared the effects of Gotu Kola extract and folic acid in improving cognitive abilities after a stroke. Both Gotu Kola and folic acid equally benefited participants, while Gotu Kola was more effective in improving memory. Some studies show that Gotu Kola may have a relaxing or anti-anxiety effect. In a 2016 study, researchers found that Gotu Kola reduced anxiety-induced behavior in mice that were sleep-deprived for 72 hours. While this research is still preliminary, it shows some promise in relieving stress and anxiety. Gotu Kola's positive effect on brain function may also make it an effective antidepressant. A review from 2016 trusted source supports these findings, in part due to a study on 33 people with generalized anxiety disorder. The participants were asked to take Gotu Kola in place of their antidepressant medication for 60 days. They self-reported decreased stress, anxiety, and depression. Animal studies have found that Gotu Kola makes it harder to become pregnant. Do not use Gotu Kola if you have any health conditions, especially liver disease. Stop using Gotu Kola for at least 2 weeks before surgery. Although there is limited research on Gotu Kola's effect on other medications, it's possible that it can interfere with prescription or over-the-counter medications. It could interact with medicines metabolized by the liver. Gotu Kola could amplify the effects of alcohol and sedative medications. Always consult your doctor before using Gotu Kola.